Schizophrenia. Uh, schizophrenia is a mental disorder, is a psychotic mental disorder. Um, the patients of schizophrenia, some of them would believe that they're the most important person in the world. They Patients of schizophrenia live in an alternate reality, uh, which is not the real reality. They live in an alternate reality in which sometimes some of them think that they are the most important person in the world. Um Napoleon, for example, they might think that they are as important as Napoleon, without any evidence to back that belief. They have no evidence that they are as good or as that popular as Napoleon, but they might think that they are. Some of them might hear voices, someone talking to them, but in reality, no one is talking to them, but they're hearing these voices in their heads that someone is talking to them. And similarly, they might see things that are not there. Uh, so, it is a very interesting topic to discuss, and it used to be called dementia precox when it was first discovered. It was called dementia precox. So, what is schizophrenia? It is a psychotic illness. It goes through different phases: prodromal phase, active phase, and residual phase. In its active phase, it has delusions, hallucinations, disorganized thinking, and this disorder is always, whenever a person gets this disorder is always severe, and it has long lasting and persistent effect on the life of the individual, and it has profoundly disruptive psychiatric symptoms and highly impaired dissocial functioning. So the diagnosis of schizophrenia is based on psychiatric history. We take patient come to us, we take their history, um, and we take their mental state exam. But there is no lab test for it. We do not test it. There is no medical test for it to diagnose schizophrenia. Uh, exact causes of schizophrenia, what is causing this illness, is unknown. But a combination of genetic, stressful life events can develop schizophrenia. But it is not very clear that why some of them develop this illness, some of them don't. Uh, a person might see his family members dying, uh, but he will not get schizophrenia. Another person is in the similar circumstances. He sees his family member dying, but he will get schizophrenia. So the exact cause is still unknown. But we can say a combination of genetics and stressful life events can develop schizophrenia. Now, the history of schizophrenia. Flavitt in 1851 described paranoid features and called it folie circulaire. Hacker in 1871 described hyperphrenia, and Kyle Bohm in 1874 described catatonia and paranoia. Um, Paranoia is now these days called delusional disorder. Emil Kraepelin then combined all of these conditions and called it dementia precox. But it was later named schizophrenia, and the word schizophrenia means split mind, and it was named schizophrenia by Bleuler. If I don't know if you're familiar with this name, this was the teacher of the person who made that test, the Ross-Charged ink blot test. This Bleuler was the teacher of that student. Uh, so Bleuler, in his monologue "Schizophrenia," wrote that distress has nothing to do with intellectual decline. This disease has nothing to do with intellectual decline. In this disease, a person does not become intellectually does not become inferior or does not become intellectually disabled because of this disease. So the intellectual decline does not occur in this disease. So that's why he renamed it schizophrenia. Um, And now, in these symptoms, in the symptoms which schizophrenia presents itself with, were present in these symptoms were described in the ancient Egyptian papyrus scrolls and Greek and Arab literature as well. No, a German psychiatrist who worked on Kurt Schneider, who worked on the schizophrenia. So the most of the symptoms that we have were first described by this man, Kurt Schneider. He did the most work on this disease called schizophrenia. He gave the first rank symptoms of schizophrenia, which are in today's DSM are called hallucinations and delusions. And he also gave second as rank symptoms of schizophrenia, which were not deemed as necessary to diagnose this illness. Um, and then TJ Crow classified schizophrenic patients into type 1 and type 2 on the basis of positive and negative symptoms. Positive symptom patients were called type 1 and negative symptom patients were called type 2. Now, the first rank symptoms of schizophrenia that were described by Schneider was audible thoughts. That thoughts are allowed if someone is speaking to the patient's thought. For example, if he's reading a newspaper, he would think he would listen to a voice. A voice would be reading his thoughts, but in reality nobody else is hearing those thoughts. Nobody else is hearing that someone is inside of his head is speaking these thoughts, but only this man is hearing those voices speaking his thoughts. uh, and voices arguing with each other, voices that are commenting on each and every one of his actions. Thought insertion. This is a belief that someone has the thoughts a patient is having were actually inserted by some other a human being or an organization or maybe government even. He would think that they are putting these thoughts into his head. Thought withdrawal, meaning that thoughts are withdrawn from him by some another person, organization, or government even. He would think that they are withdrawing these thoughts from him. And thought broadcasting, the belief that his thoughts are being broadcasted. For example, he might think that the news channel is broadcasting all of its thoughts. So in the sometimes the news organizations have these some people coming to them and asking them to stop broadcasting their thoughts. This has happened to some news organizations. So this is a first rank symptom of that Schneider described. And it has some negative impact symptoms that Schneider described: made volition, made impulse, made affect, somatic passivity, and delusional perception. So the second ranked symptoms that he described were that these were not necessary for the diagnosis of schizophrenia, were other hallucinations that he did not describe. He called them second ranked symptoms: delusional notions, perplexity, depressed or elevated mood, experienced or flattened effect, experiences of flattened effect. Now, in the DSM-5, there are five schizophrenia spectrum disorders. Number one is delusional disorder, in which only the delusions are present. Brief psychotic disorder, in which the symptoms of hallucinations and delusions is less than 1 month, is 1 month or less. A schizophrenic form disorder, in which schizophrenia is forming, uh, and the time period is 1 month to 6 months. And we have schizophrenia then, and the time period of this has 6 months. And then finally we come to affective disorder, in which a person has schizophrenia but also has a mood disorder with it, like depression. A person has schizophrenia, in addition to it, here it has a disorder like depression, then we call it a schizoaffective disorder. Now it passes through schizophrenia, passes through prodromal phase, active phase, and residual phase, and then from the residual phase it goes back to the prodromal phase. So this disease goes in cycles between these phases. Now we are going to discuss The prodromal phase symptoms of schizophrenia. What happens in this prodromal phase is that severe anxiety, severe depression, irritability, sleep disturbance. Now, the most important ones to focus on here are the sleep disturbance one. He will have sleep disturbance. For example, he will not be able to sleep. Maybe sleeping 1 or 2 hours a day. Maybe not sleeping at all. Um, so the sleep disturbances are part of the prodromal phase. Profound isolation slash withdrawal. A person with schizophrenia will, in prodromal phase, will isolate himself from the society. Will try to not talk with anyone. Maybe even lock themselves in a room. Profound isolation. We are talking about here, and deterioration in school slash work performance. Yeah, a person may be having let's say A grades in every subject at school, and all of a sudden he's getting F's or D's. He's a severe deteriorate. His school performance has severely deteriorated, and school avoidance even, and OCD phenomenon, and especially in the memory problems. We will see that they will not be able to memorize the school literature, the school subjects. They will have difficulty in those memorization. So the most important one to remember in these prodromal phase symptoms are the sleep disturbances, profound isolation slash withdrawal, deterioration in school slash work problems, and memory problems. These are the main ones that should be looked out for and should be suspected whenever a person comes with these symptoms. Schizophrenia should be suspected in that person. It should be suspected that is in a prodromal phase of schizophrenia. Now, the main active symptoms of schizophrenia. These are in the DSM-5, described in the DSM-5. Hallucinations, delusions, disorganized speech, negative symptoms, grossly disorganized or catatonic behavior. Hallucination is seeing things that are not there, hearing things that are not there. There are 8 types of hallucinations that a person can experience. Uh, he can have different types of smell. He could be smelling some things that are not there, that do not exist in real life. So there are many types of hallucinations and delusions. False beliefs that a person believes despite of the evidences against those beliefs, but a person still continues to believe in those beliefs. For example, he might think that he's a very famous person. He might think that he's a very important person in history. It could be anything. He might even think that he's a celebrity. uh, Disorganized speech. A person with disorganized speech will not be able to speak clearly his thoughts. Whatever he wants to speak, he will not be able to speak them clearly. Negative symptoms include like flat effect, unable to speak, unable to experience pleasure, etc., etc. And finally, catatonic behavior, in which a person would sit in a single position for hours and hours, sometimes 12 hours a day. So in this, it should be these symptoms should persist for 6 months or more. At least 6 months or more, it should be persist, and one of these symptoms should be hallucinations or delusions. Either it can be hallucination or delusions, and one of the other symptoms. It could be one or more of the other symptoms, but one of the symptoms must always be hallucinations or delusions, and these symptoms must persist for 6 months at least for it to be called diagnosed as schizophrenia. Now, the residual phase symptoms. In residual phase symptoms, a person might have odd beliefs, unusual beliefs. Uh, he might still have hallucinations and delusions, but they will be very minor as compared to the active phase symptoms. Distorted thinking, flat effect, lack of motivation to engage in any meaningful activities, unable to experience pleasure, um, a diminished speech, social withdrawal. They might. withdraw from the society, reduce speech. They might not speak whenever is required of them to speak, and whenever they are forced to speak, they will have nothing to say. So this is a part of the residual phase symptoms of the schizophrenia. After active phase comes the residual phase. Um, and after residual phase, this cycle continues, goes back to the active phase symptoms. The disorders of thought in schizophrenia. One is a thought insertion, that some believes that the thoughts a person is having is inserted by someone else. Thought withdrawal, thinking that his thoughts are being taken away from someone. Thought broadcasting, that a person might think that someone is broadcasting their thought to the public, or they can hear their thoughts. Thought blocking, sudden interruption of thought, leaving a blank. Now, there are many types of delusions. So the main ones are persecution. Person might believe that the society wants to harm him or harass him. And grandeur delusions. The person might think that he's someone important in history. For example, a son of God, maybe a famous person, or a person with special abilities. Now, the most interesting one of these is Capgras syndrome. He might think that his spouse is not actually his spouse, but is actually replaced by another double. His spouse is not his spouse, but is actually another person, which is same in appearance to his spouse or her spouse. And Fragile symptoms. It is a belief that people are actually one person, which keep on changing their appearance. All the people in his life are actually one person, but they keep on changing their appearance. This is Fragile syndrome. Now, disorder of the motor behavior. In the motor behavior, like normal behavior, we can talk, we can walk, we can go here and there. The disorders of that behavior are most interesting one of them would be echopraxia, like automatic intimation of another person's movements, even though when asked not to. Uh, a person might imitate whatever another person is doing in front of him. If a person in front of him points to something, then this person will also point to that thing. He will repeat that movement constantly, even though he will be asked not to do it. He will keep on repeating those movements. This is called echopraxia. And stereotype is repeatedly regular fixed parts of movements which are not goal directed. For example, he might rotate his arms continuously without any purpose, without any goal. Negativism, in which a person is sitting in one place constantly and is resisting his attempt, other people's attempts to move him, and sometimes even doing opposite of what is being asked to do. He might be asked to move from his position. He will resist that, and he will be doing the opposite of that, which is being asked to do. Posturing, bizarre. He will be sitting on a bizarre posture, bizarre bodily posture for a long period of time, and because of that, he will have some waxy flexibility in his muscles. For example, his muscle will be so waxy that you can put his muscle in a bowl, for example, and it will adopt the shape of the bowl because of the very long time of sitting in one position. Now its treatment. Now I will only talk about second generation medication, since I'm a psychologist and medications are not my area of expertise. So I will only talk about the second. I will only mention second generation of medication. And Clozapine, olanzapine. These medications are used to treat schizophrenia. Their side effects would be weight gain, higher blood pressure and close blood sugar and cholesterol level, high blood pressure, type 2 diabetes, dry mouth, blurry vision. Now, what can we use to treat schizophrenia? There are some CBT techniques we can use to treat schizophrenia. No, we can use. There are two models of two types of treatment of CBT that we can use in this case. So one is that we can use a symptom-based treatment, for example, to reduce the hallucination and delusions. We can understand the origin of their faulty beliefs. What is causing those faulty beliefs? Number two, we can test the validity of their faulty beliefs about hallucinations and delusions. We can do them in the therapy session. We can whenever they're describing their hallucinations and delusions, we can ask them, for example, if we can ask them, if you can hear some voices, these voices, why is it that no one else can hear them? um, and then what will happen is that uh, patient will start looking for alternate, less threatening explanation of those hallucinations and delusions. Uh, and then we can give coping strategies to the patient to take control of their hallucinations and delusions. This is what we can do in symptom-based treatment. In cognitive restructuring model, we can do ABCDEF model, identifying the activating event, exploring what beliefs it caused, and recognizing the consequences of that, and then disputing those irrational beliefs, and then effect restructured belief. What what are the new beliefs that were formed as a result of that disrupting of the irrational beliefs? This is the effect. And then we can develop more positive feelings. We can see that more positive feelings are being developed in the patient. Now, the second thing we can do when using CBT for schizophrenia is to try to increase the normal behavior of that person. I personally think that this is much better than the previous form of treatment. When we are challenging the symptoms of the patient, I think this is much better solution than that. In this, we will try to, instead of reducing the hallucination and delusions, we try to increase the patient's normal behavior. Um, and then that normal behavior will cause a reduction in hallucinations, delusions, memory problems, attention problems. For example, when a schizophrenia phrenic patient has delusions, and he might be thinking that all of the school wants to kill him or harm him. Because of that, he's afraid to school to go to school. What we can do here is we could you force him to go to school using techniques such as flooding. Flooding is a technique in behavior therapy. After that, repeated exposure, his delusion will start to reduce. He will start to go to school as normal, and because of that normal behavior, his symptoms will also start to become normal. His delusions will start to become normal. He will, because of his normal behavior, his thoughts will also start to become normal. I think this is a much better solution than the symptom-based treatment that I described earlier. Now, the prognosis of schizophrenia. If a patient has the onset of schizophrenia after the age of 35, then it has a good prognosis. It is much better. It is a much better outlook to be treated. I mean, uh, schizophrenic symptoms. Let's say schizophrenia can be treated much more successfully if the onset is after the age of 35. And if a patient is female, then it is also good prognosis. If the duration of the psychotic episode is less than the 6 months, psychotic episode is the episode of the active phase of schizophrenia when the hallucinations or delusions are most common and are seen. Um, So if the duration is less than 6 months, then it has a good prognosis. Ventricles in the CT scan are not enlarged, then it has a good prognosis. If it is caused by a life stressor, if some life stressor such as witnessing someone's death um, caused this schizophrenia, then it is a good prognosis. But if there was no life stressor and the person is still experiencing schizophrenic symptoms, then it has a bad prognosis. If a person is educated individual, he has a good prognosis, and if a person is uneducated, then he will have a bad prognosis of this. That is all for today. If you have any questions, then feel free to ask them. Uh, Schizophrenia is a psychotic disorder. It is not curable, but it is manageable. And if a person has, let's say, one psychotic episode or two psychotic episode, most patients with one or two psychotic episodes will go on to live a very normal and fulfilling lives. Uh, but more than that, the more the psychotic episodes are, the less chances of of the brain returning to normal functioning. So it is mostly caused by the increase in the dopamine neurotransmitter within the brain. Dopamine increase of the dopamine person is because of that person experiences hallucinations and delusions. Thank you so much.